I'm Dr. Troy Spurrill, and our podcast is Synapse Snips. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse Snips each and every week where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's official synapse, synapse.com. This is Dr. Troy Spurrill coming to you live on Synapse Snips, and today we're joined by Dr. Ellie, who is our specialist here at Synapse when it comes to pelvic floor, everything that is pelvic floor. We're going to go beyond the basics today to help you get a greater understanding of how to work with your pelvic floor. A lot of people think that Kegels are the only way to actually work with, develop, and improve pelvic floor function. And we're here to tell you that that is just a drop in the bucket when it comes to actually improving the pelvic floor health. So without any further explanation from me, I'm going to go right to Dr. Ellie here and have you start talking about, first of all, what are some of the things that we see with pelvic floor dysfunction? And then just share some of the gems for the people listening.
Yeah, so pelvic floor dysfunction can kind of cover a lot of different varieties. One, it can cover the muscles themselves. So if you have pain in that area, typically that's caused by pelvic floor dysfunction. But also, it typically refers to one of those three organs in the areas. And we'll kind of walk through all of the different organs and what different sensations you'll be experiencing with each one. But the three main organs that we work with are the bladder, the rectum, and the vagina. And so the muscles that go to all three of those organs also go to those muscles directly. That's called the pudendal nerve. And so typically, if one of those organs or those muscles are dysfunctional, then they kind of cause a cascade of that whole area becomes dysfunctional. So I'll kind of show you guys on a model, but I know this is a podcast, so I'll also describe it a little bit more in detail. So I have my little buddy here. This is the pelvic floor. We can see that the white surrounding areas are the bones. And if we look underneath, there's actually no bones underneath. So what that entails is that everything that from our torso is being held up by muscles, which is good because if we didn't have that, we wouldn't have as much flexibility, and women, we wouldn't be able to give birth if there were bones under here supporting us. So we have a cascade of muscles supporting us. And from the inside, we can also see that it's just a big bowl of muscle. So overall, that's what our pelvic floor is.
I'm gonna bring up another picture here as well, because this is kind of a side view here, so you can see where the actual organs are as well. So we've got the uterus and bladder right in the front there, and you can see how the uterus can sit on top of the bladder. I have a lot of women talk about how when they get pregnant, they feel like they always have to go to the bathroom. Well, you can see why. Look at how just a little bit of baby inside the uterus and can start to put pressure right here in and on the bladder. So never mind that. You've got the bowels also and the rectum here on the back end here. So sometimes with swelling and things of that nature with our digestive system, it can also apply pressure in this area. So tell us a little bit about some of the therapies you do, because I know you do a lot more than just Kegels, right?
Yes. Yeah, definitely. So I start with all of my patients. I like to do an exam. So I do an external exam. I check out their mid back, their low back, hips, knees, feet. All of those are correlated to the pelvic floor. And then I also do an internal exam. So I actually test the muscles of the pelvic floor themselves so I can see if they're too tight or if they're too weak. Now that is essential for the type of treatment that you receive. And why is that? Is because oftentimes I find that women are actually too tight in the pelvic floor and not actually too weak. So what that would look like is that, say you have your bicep constantly contracted because it's too tight. if you just strengthen it, by example, do just Kegels, you're constantly contracting a tight muscle and you're not going to get anywhere with it. So what you need to do instead is actually lengthen and stretch the proper muscles first so that you can have a strong contraction. This is kind of getting into the physiology of the muscle. So we use the muscle spindle theory, where we use the actin and the myosin head. And the actin and myosin head can actually be overbound to one another, actually causing weakness. I'm a professor, so I just talked about this last week with my class, and they were shocked that if a muscle is too tight, it actually becomes too weak.
Yep.
And so making sure that that is seeing which one you are is essential for treatment.
Yeah, and from a brain perspective, it's the muscle spindles and the Golgi tendon organs when they send feedback mechanisms to the brain, and then the brain can regulate that. So I really want people to hear this, because you said something very profound there, that you look at muscles not just in the pelvic floor, but the muscles below that as well. Muscles in the knees are relevant, the legs. All these things can set up an imbalance that then shifts the pelvic plane, so that different muscles are pulling and are tight and different muscles are weak. And so loose, weak muscles is one thing. Tight, weak muscles is another thing. Two completely different ways to actually assess and address it. And so it's very, very important to get the specifics and measure all of these different muscles so that you can know which muscles you need to stretch and strengthen and what muscles you need to contract and strengthen. It kind of sets a whole different picture in place as far as what that treatment looks like. Did I summarize that right?
Yeah, no, that's excellent. And yeah. I had a patient that had knee surgery about 10 years ago, and she didn't get proper PT, or the PT just didn't quite work with her in the right way. And so one of her foot was completely externally rotated. And so so she came to me with pelvic floor dysfunction. And so we talked about that knee, and I noticed that all of the muscles that attach to the knee in that inner thigh go and attach to the pelvic floor.
Yep.
So I worked on her knee. We got her foot nice and aligned again. And then we worked on the pelvic floor, and she was cured within 3 months, and she was having these symptoms for 5 years. So we look at the whole body, because if you only look on the pelvic floor, you won't get sustainable long-term healing.
Yes. And part of me, just what I've seen in other areas of the body too, when you have muscles that are tight and you go and reset them and you stretch them, but they keep going back, many times it's because there's another mechanism, like you just described, further down, that's actually causing the problem. So our feet, our knees, our thighs, all those things can actually contribute to a functional mechanism of pelvic floor dysfunction. So it's important to know that if you do some therapies like Kegels and you get some temporary relief, but it doesn't hold, something's being missed. Does that sound right?
Yes, that's absolutely the case. I see so many patients that are like, I did Kegels, I've tried to strengthen my pelvic floor, but I still have leakage or I still have pain. Like, why is that? I've already tried pelvic floor therapy. I don't know if it's for me. And it's because that's kind of a very simplistic 5% of what pelvic floor therapy actually is. Yeah.
Well, and one of the things that's very unique at Synapse, we have different technologies. One of them is called the M-Cella chair, and it's radio frequency that actually helps to stimulate the pelvic floor. It's the equivalent of doing 12,000 Kegels in a 30-minute session. So it's very, very powerful. There are times, like we go to Dr. Ellie and say, is this person a candidate after they've seen her? Because she'll know. She'll say, no. This is one of those scenarios where we have a tight and weak muscle here. So M-Cella will be contraindicated. It's not going to be the right next step. So it's a tool in our toolbox we have here, but it's very, very important for us to know when to apply it, because when we do apply it to the right people, it works brilliantly.
Amazing.
When you give it to someone who's tight and weak, it doesn't have the same response because you're trying to get them to loosen up.
Yeah, no, very good point. I love the M-Cella. My patients get such fast results, but applying it at the right time of the treatment is essential for actual healing.
Yep, that's right. So it's kind of like if you're baking a cake, you want to make sure you put the eggs in the beginning, not after it's already been in the oven and you've got everything's already cooked, right? Timing is everything.
It is.
Yes. So who's struggling with pelvic floor dysfunction, generally speaking?
Oh, geez, so many. So I work only with women, just because the pelvic floor of men and women are vastly different. And so I like to specialize. And so when it comes to women, about 1 in 3 women actually experience pelvic floor dysfunction. And that can look different. So it could be urinary incontinence, it could be sexual pain, it could be rectal leakage. There's also a lot of prolapses. And then, of course, we have our pregnant women who every pregnant woman should get pelvic floor therapy. It's like kind of if you go and have shoulder surgery, but you don't do PT afterwards. Pregnancy is traumatic to the area and it needs to heal properly. Otherwise, it never heals properly. And I see women 20 years after and they're like, I haven't been the same since I've had my babies. And that just shouldn't be the case. That shouldn't be normal anymore.
I see a value with people getting with women getting their pelvic floor assessed pre-pregnancy, because pregnancy and especially delivery, to me, that's like an Olympic athlete training for the Olympics, right? So
Absolutely.
pregnancy is basically an 8 to 12 to 16-hour contraction of muscles. And if you have been balancing your pelvic floor and doing a lot of work there, then you're prepped for that Olympic moment where you're about to win the gold medal of having that baby, right? So so I have many kids. So I won't go into how many, but let's just say it's over 2. But we actually did home births and we worked on pelvic floor stability, specifically the pelvis and the rotation. Now, I didn't at that time have the information that you have now and didn't go into as much depth, but we found that the delivery was so much better when people had their pelvises just rotated in alignment. And we worked on just balancing the muscles. So I did the balancing the muscles in the legs and things of that nature, not the specific assessment that you do with the pelvic floor. I would have loved to have had that, but I don't believe when my kids were born, you were even thinking about being a doctor of any sort at that time. So it's pre-pregnancy. I really want women to hear this. It's like an athlete stretches and works out and strengthens ahead of their Olympic event. That's what we're talking about here for women. That's how important your pelvic floor is to the entirety of the process. Not only that, but when you are carrying the baby to term, the 9 months that baby is developing in the womb here, getting things as balanced and stable as possible so there's as much room for the baby and that you feel the benefit of that as well as mom. That'll help with sleep. That'll help with many things like back pains of labor or back pains of pregnancy. So there's a lot of benefit. We also found early on in our career that when we had pregnant women balance their pelvic plane, that they didn't hold as much water in many cases, because again, when women are really twisted and torqued, then that basically can cut off some of the natural mechanisms for draining of this fluid. So I am encouraging women to actually check out their pelvic floor before they even get pregnant, as well as after.
Yeah, definitely. And even during delivery itself, if you have a strong pelvic floor, but also a relaxed pelvic floor. So again, we are looking for that balance. We don't want it too tight, but we don't want it too weak. We want it strong but flexible. So then that combination significantly decreases the tearing of that perineal. And so that is just amazing. It decreases labor time, it decreases the risk of that tear, and then it also improves recovery within that next 6 weeks that you can't really do much. Having a strong pelvic floor, you just have a significant, like quicker healing, both in that bladder incontinence, which is very common post-delivery, but then also with that sexual health, women are able to go back to that quicker or have less pain with that postpartum too.
How long does it take for someone to go through a pelvic floor rehab, or is there a difference between someone, let's say pre and post pregnancy, but give us a bit of a timeline on what treatment looks like.
Yeah, so it varies per person, kind of as all treatment does, but on average, so if a woman comes to me and they've only had symptoms for about a year, I typically can get them about 90% within 3 months of treatment. Now, if a woman comes to me and they've had it for 20 years, sometimes that takes a little bit longer, but within that 3 months, we're able to get about 50 to 80% where they're able to function throughout the day and not really have the symptoms the majority of the time, and that they only really experience the symptoms under extreme stress.
That's great. So, any other gems as far as just for women to take care of their pelvic floor health in general? What are some things they can do just proactively at home to help with pelvic floor health?
Yeah, so there's a lot. I'm really into education, so you will be an expert in your pelvic floor by the time you're done working with me. You'll
Ah,
be able to,
love it.
you'll know it so well. But some of the things that I want just women to be aware of is that just in case urination. So this kind of comes into play if you're leaving the house and you are like, I don't know when I'm going to have the bathroom next. I don't have to go to the bathroom, but I'm going to go just in case. Kind of those type of symptoms. A lot of women do that because they feel like once they're out, they can't hold their bladder and they don't have a strong pelvic floor.
Yeah.
And so that's kind of a sign that your pelvic floor is dysfunctional if you feel like you have to go all the time. But that actually can retrain the bladder to become more sensitive, and then you actually have to go to the bathroom more often. So it's this very negative cycle that you can make the bladder just more sensitive. Another just kind of pro tip is that squatty potties, they're actually really remarkable. So there's a muscle that wraps around the rectum, and your knees actually need to be elevated for that muscle to be relaxed. And so a lot of that relaxation is important for the proper posture. But then also exhaling on defecation allows your rectum to also be more relaxed. So a lot of people contract and hold when they're
Yeah,
trying to defecate, but breathing out is actually the best way for the pelvic floor.
that's awesome. I knew the squatty potty was good.
Yes, it is. It was worth the hype.
Yeah, it was worth the hype. Just fun to say too, squatty potty.
It is. It's a fun, yeah, they did good on marketing for sure.
All right. So when it comes to complications or challenges, what are some of the harder pelvic floor scenarios you've had to address? Or is this something where you pretty confident you get everything across the board?
Yeah, so I'll kind of talk through some of the symptoms that I see most common and then talk about some of my more complicated patients. So one symptom that I see a lot is actually prolapse, which is when the bladder or the rectum actually falls into the vagina because of that loose pelvic floor or those loose ligaments. And you can know if you have one is if you go to the bathroom and you urinate, and then 5 minutes later you feel like you have to go again, or you just feel like you can't, or you have to wiggle around while you're urinating. That's just a sign that some of your bladder fell into your vagina. And so depending on how severe the prolapse is, I can help with it. So there's grades of 1 to 4. I can help grades 1 through 2.
Yeah.
And then those 3 and 4s are kind of those more complicated where the bladder is actually falling out of the vagina and it's exiting that perineal and you can see it externally. That typically is referred to surgery. But so that would be a really complicated case. But for those prolapses, we see really good results with that. A lot of times, other complicated cases are with sexual pain. So women should never experience any sort of pain when it comes to intercourse. And there's kind of two main reasons why women would experience it. One is because of their hormones. So if you have pain and it feels like it's sandpapery or it feels very dry, or even your partner can also talk about how dry it is, that's actually pointing to hormonal dysfunction, typically lower estrogen. And so no worries, we have a PA here that's remarkable. And so she puts you on the proper amount of hormones and you can heal just with that. But then another way that women can have pain is from just tightness. So the pelvic floor can be too tight, and so it won't be able to receive penetration. And so that I typically can get everything relaxed within 3 months. And that is really exciting because then women can experience that intercourse again that's so essential for a healthy marriage. And then we can help the marriage as well. So the pelvic floor is always just more than just, oh, I can't hold my bladder. There's always different factors that come into play.
Yeah, that's awesome. One of the other things that comes up, you kind of spoke to it as far as just the stage 1, 2, 3, or 4 when it comes to the prolapse. And I just want to encourage women to have awareness of where they might be at with that, because it is much, much easier to work with stage 1 and 2. And if you want to prevent a surgery, that you want to be proactive going after that. So one of the things that we also, you may or may not comment on this, so it's okay. You can let me know if you want to defer to talk about this another time. But part of the MCELA technology uses that radio frequency that reestablishes contractions of the muscles. And there's also a technology that deals with vaginal rejuvenation when it comes to that scenario. And so do you want to touch on that this time, or do you want to say that for another podcast?
Yeah, we can talk about that. So
okay,
that machine is called the MFEM. And that's an internal device that causes contractions of your entire pelvic floor. So we have a superficial pelvic floor and a deep pelvic floor. And so what that does is that contractions increase the blood flow to the area. And it really allows for that muscles to become stronger and more lubricated because of that blood flow. So it really helps with women who do experience pain with intercourse, but then also who just don't feel quite like themselves too. I love that machine. It does really good wonders.
Yeah, great technology, and gives us some access to restore function that has been lost because of life, basically, in a lot of ways. So, all right. So just to finish up, any other last gems when it comes to just pelvic floor, and maybe share with us testimony of a success that just stuck out to you. No names, just give us like a little bit of what happened and how their life changed because of it.
Yeah. No, this is great. I love talking about my patients. So I had one that we just finished treatment this week, and she came in because she had rectal leakage. And so she wouldn't be able to go on a walk without having a huge supply of toilet paper because she never knew when the rectal leakage would happen. Yeah. And that was her life for about 3 years. So anytime she left the house, she would always have an extra pair of underwear and sometimes pants. She would never wear white. And she just kind of had constant anxiety. She would cancel lunch plans because she's like, I just don't know if I'm going to go to the bathroom on myself. Yeah. And so within 3 months, we were able to have her not have to, she was able to wear white again. She doesn't bring toilet paper. She can walk for hours. And she knows that her body can handle the stress of the day-to-day life. And the really fun part too is that she came in and she had low back pain. She had knee pain. And now she's like, I've never been as strong as I am now. And she can do really deep squats, and she feels more flexible than she ever has. And so it always kind of just helps with the whole body, but also the really important part is that mental strength too. She feels confident in her body again. She feels like her body can handle things, and she has so much less anxiety. And that's a common thing that I find with a lot of my patients, is that just the decrease of anxiety. Yeah. That's what I love to work with too.
That's what I've noticed with the people we've sent to you, because we work in other areas at the same time. A lot of our patients are going back and forth. But a lot of my anxiety patients who've had pelvic floor dysfunction, their anxiety's improved. That's like a not with everyone, but it's like a great little side effect. And I could see why. Just the quality of life. I'm not necessarily into whether or not you wear white after Labor Day or anything like that. She now has the option to wear white at any time of the year. Yeah, she might be wearing it off season at this point because she's able to. But
make up for last time.
Yeah. So that's life changing, and so I really feel like someone needed to hear that, because we are seeing that, and our pelvic floor, which is really like the bottom part of our diaphragm, we see angst and we see just whole body changes when we get this baseline foundational part of our body addressed. So someone needed to hear this today. I thank you for your time, Dr. Ellie, and I look forward to seeing many more women be blessed by your treatments and therapies. And just thank you for your services at Synapse. It's a blessing to us practitioners who are able to just send them to you and know they're in good hands.
Thanks. This was fun.
Till next time.
Bye.
Thank you for listening to the Synapse Snips podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse Snips podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or a substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.